Good afternoon, Mr. Collin. I'm Karen. I'm your CNA for the day, and I'm here to go ahead and get your vital signs. Before we get started, I'm going to close the door for your privacy, and I'm going to get my hands washed. You may bring a watch of your own, or you may use one that will be provided in the lab. Position yourself on one side of the resident. The evaluator will position herself on the other side. It's fine to get down in whatever position is comfortable for you. Locate the radial pulse on the thumb side of the resident. Once you've located it, it is necessary for you to tell the evaluator when you're starting and when you're stopping, so you all can be counting at the same time. For the purpose of the video, I will not count for 1 full minute. However, it is required that you count for 1 full minute during this skill. I also suggest you make the start when the second hand is facing straight up. I'm ready to begin. Go. Stop. Mr. Collin, here's your call light if you need anything. I'm going to get my hands washed, and then the last step will be to record on the paper provided. The automatic failure for this skill is being off by more than 4 beats, plus or minus of the evaluator's pulse reading. If for some reason you're having a difficult time palpating the pulse of the partner you were given, you can ask to switch sides. If you are still having a difficult time palpating the pulse, ask the evaluator if they can send in an additional client. That completes recording radial pulse. Good afternoon, Mr. Collin. I'm Karen. I'm your CNA for the day, and I'm here to get your vital signs. Let me close the door for your privacy and get my hands washed. On the day of the exam, you may use your own watch, or you may use the one that's been provided for in the lab. You will get on one side of the resident. The evaluator will get on the other side. You will count respirations for 1 full minute. You may either watch the rise and fall of the chest, or you may place the hand on the chest and feel for the chest movement. For the purpose of this video, I will not count for an entire minute. However, it is required that you do 1 full minute. Again, I suggest that you always start when the second hand is straight up at the 12 to avoid confusion. Tell the evaluator when you're ready to begin, and begin. Stop. I want to go ahead and give you your call light. Wash my hands, and then record on the document that's been provided for respirations. The automatic failure for respirations is being off by more than 2 plus or minus of the evaluator's reading. If at any time you feel you have lost count or you are uncertain about the answer that you got, it is suggested that you ask to recount for an additional minute. All you've lost is time, and it could ensure accuracy. That completes, counts, and records respirations.